Greetings. Let us talk about the use of an overtube in gastrointestinal endoscopy. So these are my acknowledgements, and today's learning objectives include the following. We will learn about the use of an overtube in a GI endoscopy unit and how do we go about setting it up and using it. So before we go there, let us open up and see how an overtube looks like. And let us learn the different elements of an overtube. It has a soft inner tube going through an outer tube that is a little bit stiff, and there is an inner tube air seal that prevents air from escaping and maintaining the insufflation, and there is an insufflation cap, and that you use at a different point in the procedure. So we will go through when you use these different caps. So in basically, overtube has an inner tube and an outer tube and two caps. One cap for the inner tube and another cap for the outer tube. Depending upon what is used, you can apply those different caps. So let us learn about how to set up an overtube step by step. First step is remove the inner tube and then lubricate both the inner tube and the outer tube. Generous lubrication is very important. And following that lubrication, you insert the inner tube into the outer tube till it is almost snug, and then you insert the endoscope into the inner tube till the endoscope comes out through the other end. Now, with this setup, the endoscope with the overtube setup, this is ready for use. So now, how do we use this system and what are the precautions we need to take? If you're using this device to enter into the esophagus and stomach, it's important to ask the anesthetist or your nurse to extend the jaw and either give a jaw thrust to open up the upper airway and straighten the oropharynx to the esophagus, so that the insertion of this device, which is a little bit bigger than the endoscope and it's a little more stiffer, and you have to have a relatively straight path for the insertion of this device. It's also important to lubricate so that your insertion is easy. Make sure when you lubricate, you just lubricate the tip and not lubricate your hands. This device is too big to go through the bite block, hence it's important to remove the bite block before inserting this device. So you gently insert the endoscope loaded with the overtube into the stomach all the way, and then what you do is you remove the endoscope and the inner tube together. Basically, you take it out. So the inner tube is basically used to allow you to go in, and then once it's out, you take the inner tube and the endoscope out, and then you place the insufflation cap over the outer tube, and that maintains the air insufflation, and then you reinsert the endoscope into the stomach through that outer tube that's already in place. So now you can do whatever you want to do. The overtubes come in different lengths. You can have a short overtube for just the esophagus, a longer overtube that can go into the stomach, and you could use that when you want to remove some foreign bodies, or you want to evacuate the stomach, or you want to repeatedly go in and out for different procedures like a prolonged endoscopic resection or submucosal dissection. These are all so that you do not traumatize the patient's pharynx by going in and out with the scope. Instead, the outer tube protects that pathway, and you can just go in and out. It's important to make sure that this procedure is performed gently to prevent lacerations of the upper esophageal sphincter and hypopharynx. And it is key to lubricate the device, and it's also important to keep that upper airway straight by extending the jaw, and so that the insertion of the endoscope loaded with the overtube is relatively easy. If the patient has been intubated, it is a good idea to request the anesthesiologist if they could paralyze the patient so that the upper esophageal sphincter will relax for the overtube to go down easily. I hope this is useful. Thank you.